Okay, I'm just coming to my operating theatre in London, and I've got a case to operate a bit later on this afternoon, and I thought I'd just connect with my colleagues around the globe to get some advice about this case. So, Ian, how are you? Thanks for joining us.
Good. Thanks for having me. I'm here in downtown Atlanta, Georgia right now.
Thanks for joining us. And Harrison, hey, how are you?
Hey, Shafi, good seeing you again. I'm currently in downtown San Francisco at the W Hotel.
Lovely. Well, thanks for joining us. And I thought we could discuss this case a bit further. Ian, would you mind bringing out the scan that we were talking about earlier in the day?
Sure. Let me just go to my files here. I'll pick that out quickly. Bring that into the scene on my table. You can check that out. Got a nice, beautiful model here.
Okay, so what we can see now is a 3D model taken from a CT scan of the vertebral column, thoracic cage, and also the pelvis. And we can walk all the way around this structure together, looking at the various parts of the anatomy. And similarly, we could do that to any scan of any operation in this space. We'll also share some files of the patient, some records, some clinical notes to discuss further. Now, Ian, you were mentioning a little area that you were concerned with earlier. Can you just show me that on the model?
Let me just grab my drawing tool quickly here, and I'll adjust my pen size. So actually, I was wondering, what right here on this model is this little bone structure? I don't remember seeing this in my anatomy textbook back in high school.
And that's because it wasn't there at your medical school before. This is actually an osteophyte. What you can see here, Ian, is that you've got the vertebral discs, and that's at the L5 vertebral column, and it's anterior and superior. And there's a bit of bone that's jutting up, causing a bit of compression of that space, but actually, laterally the nerves seem okay, the nerve roots seem all right. But something that's worth commenting upon, and thanks for showing that on this model, using the HoloLens. But it's just a demonstration of what can be achieved to make healthcare more equitable, more fair, and how we can use our resources around the globe.
Hello everyone to the Alternative Doctors Conference Expo 2017. A warm welcome from me and many congratulations to Raj, Sethi and his team who've done a fantastic job the last couple of days in creating a huge interest and passion around medicine and innovation. A quick thank you of course must apply to Andy Burnham, the Mayor of Manchester, for his kind words and his support in his video presentation, and also to Tony Young, the Director of Innovation in the NHS, for his support in this venture. Also Dr. Puri, who happens to be the Deputy High Commissioner of India, and also to Kailash Chand, who's supporting this event and also hopefully will be attending today. Thank you very much for the attendance. So I am a consultant surgeon, I'm also an entrepreneur, and I'm very interested in technology and how it's utilised in healthcare and also for education. Technology itself is rapidly advancing. We're suddenly in the middle of what's called the fourth industrial revolution, which is all these technologies coming together to improve patient outcomes, make healthcare more efficient, and improve teaching and training across the globe. So the technologies that are interesting in the future, of course, are things like artificial intelligence, robotics, virtual reality, augmented reality, wearable sensors. There's a whole issue around data and blockchain. All of these things are coming together at the same time, making medicine the most exciting time to be around. I can't remember a time in my whole career where I've been so enthused and impassioned by this whole future of our sort of practice. I spend a lot of my time around the world talking about future technology. They call me a futurist. And I'm so impressed with the current state of the healthcare in the NHS, with organisations, for example, like NHS Digital, NHS Innovation, and also the academic health science centres taking a big leading role in the implementation of digital health and technology.
Yeah.
We've already disrupted undergraduate medical school teaching at Barts Medical School. Last year, we ran the first ever Barts X Medicine programme. This was, of course, designed to create better future doctors. The health service needs future doctors to be innovative, It needs them to think outside the box. It needs them to also to take control and think about entrepreneurship in improving patient healthcare and making healthcare more efficient. So we ran a program where our students for the first time were not taught by the traditional anatomists, physiologists or biochemists or clinicians. They were taught by venture capitalists, entrepreneurs, coders, developers, business developers, people talk about intellectual property rights, and also my team from Singularity University in the US and also from Harvard beamed in live to talk about the future of medicine, because we need to almost inspire the new young generation of medical students. The students were then given a chance to form groups, create business cases so that they could think about how they could redesign healthcare, make it more efficient with either an app or another solution. They were given mentorship by tech entrepreneurs. They were then came to a competition for a hackathon and a pitch like a Dragon's Den in front of tech specialists. The winners were given a placement for a few months with BMJ Digital, who was so supportive, to see whether we could take something to market. This is the way we create the new generation of doctors that healthcare needs. I'm hoping, of course, that this kind of course becomes part of all curriculum up and down the country. This has naturally led to the development of what we call the Faculty of Digital Health. This is a new organisation with a really strong steering group and leadership to think about how do we reflect the changing practice and sort of put in digital health into the curriculum up and down the country in every medical school. So the next few months and a year or so, the team will be working on a whole agenda of standard setting, governance, and looking at how we inspire and also ask the curriculums to change accordingly to future requirements so that we can produce the doctors of tomorrow, what I call the digital doctor or the connected doctor, because the curriculum has to change to respond to the needs of our patients and also to the needs where technology is making an impact. So hopefully you'll support me in our missions to make healthcare more accessible and also using technology as interface to improve the outcomes for all our patients and also to improve education. So enjoy the day. Congratulations again to the wonderful conference the last couple of days and I wish you well.